Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited to have a very special guest today, Dr. Cynthia Calixte. And you know what? I'm just going to let her tell us about herself.
Thank you, Dr. DeRowan. I am Haitian American. I like to identify myself with my ethnicity because culture is really important to me. My parents were born in Haiti, so I'm first generation. I am a New Yorker. I wasn't born in New York, but I pretty much grew up there, went to college, med school, so that is where I'm from. And I know I don't have the New York accent because that's always the next question that people follow along with, but I grew up on Long Island. My friends describe me as the caretaker, and I often get the joke that I'm the mom of the group. So medicine has always been a passion of mine. It's something that I've wanted to do since a young age. And I think trying to think of the definitive age that I decided. I think I probably was 12 or 13 when I decided I wanted to do medicine. So I don't regret my decision. It's definitely a rewarding job. But that's me in a nutshell.
Awesome. And you are a family medicine physician. Can you tell me what made you choose family medicine as a specialty?
So when I initially started school, I thought I'd be doing peds. But I had the opportunity my first year of med school to shadow this family medicine doctor who was actually doing a women's health fellowship, and I was helping her with her research project with data collection. And that was my first exposure to family medicine. And I also got to watch her, as she was providing patient care at school-based clinics and also at a community health center. And I was just amazed by the breadth of all the things that she was doing. And I was like, wow, this is so cool. I didn't realize you could do so much more than just see kids. And that's really the point when I started to fall in love with women's health, and I wanted to do both at that point. So I always had it in my mind since then. I was like, yeah, family medicine's for me.
So can you tell the students a little more about what you do now in your current life in terms of family medicine and what kind of practice you're working at and what kind of women's health you're involved in?
Okay, sure. So I do multiple things, which is one of the wonderful things about family medicine is that we can do so many different things. So my primary job is at an FQHC.
What's that?
An FQHC is a federally qualified health center, and the center where I'm working at is in a rural setting. So we're the only one for the 3 major counties on the eastern shore of Maryland. So pretty significant. And what a community center does is pretty much it provides not only primary care, but mental health, dental care, all in one location. So everything is accessible to patients. And we also have social work and case managers available to provide whatever resources patients have. And we see patients regardless of whether or not they have insurance. So we do not turn patients away. So that is my primary job.
Okay, that's really a necessary mission, working at a federally qualified health center, because there are so many patients in need of care. And in this current state of our healthcare system, a lot of patients don't have insurance or they're underinsured. So it's important that there is some place where patients can go and get quality care, as well as have all of those other things in place, like you mentioned, what they like to call a primary care home, where there is pharmacy and mental health providers, dentists, and primary care providers available to kind of treat their whole family. So that's something that's very important, and especially in a rural area.
Yeah, it definitely is. And I was exposed early on to community health center when I was shadowing that doctor that I mentioned, but also one of the things that I got to do was a summer internship with WIC, the Women's Infant Child Program, and it was also at a community health center in the Bronx. So I got exposure to all the things that could be available in a community health center, and I fell in love with the setting, and I just knew that that's where I wanted to be practicing when I was finally a doctor. So It's a very challenging job, especially when you're trying to meet the needs of a lot of social needs for the patient so that they can maintain their health. But it's a very rewarding job. The second job that I have is actually with the health department for the county that I'm working at. So I have a master's in public health, and which is another reason why I love family medicine, because it focuses on the community aspect. And so by obtaining my master's in public health, I felt like that was more of a robust picture and would allow me to better suit my patients and actually understand the community that I'm serving. So I'm the physician deputy, and as a physician deputy, pretty much I oversee the orders for the various clinics that we have. And for the county that I'm serving, we have a reproductive health clinic, which I help run with the midwife. And I also have a clinic where I'm seeing tuberculosis patients that may be exposed or recently diagnosed and managing their care. And then I also am responsible for providing various vaccinations that the community may require, especially if they don't have insurance. They come to the health department and we provide them with whatever resources they may have. So that's my role as a physician deputy at the health department. My third job.
Wow, you have so many.
Yes, I do. I work for Planned Parenthood. I am an abortion provider. I work there about 1 to 2 times a month, and it's very rewarding to be able to provide a service to women, especially at times like this where resources are limited and the access to care is very limited. So that's one of the most rewarding aspects of one of my job as an abortion provider. And my fourth job So I am the co-leader for Advocacy group. The organization is called the Reproductive Health Access Project, and there are various clusters throughout the country. And since I'm in Maryland, I'm in the Mid-Atlantic cluster, so I'm the co-leader of that cluster. And pretty much it's primary care clinicians throughout the state of Maryland, and also in like the DC area, where we meet 4 times a year, sometimes a little bit more, and we focus on ways that we can ourselves protect and expand access to not only abortion care, but also contraception care, miscarriage management in our various communities. And so we have various activities where we can talk amongst each other and provide support to one another. The last time we actually met was in September, where we were talking about the importance of voting and encouraging our patients to vote. So we had a great meeting where we had a guest speaker, come and talk to us about the ways that we can vote ourselves and also educate our patients on the various ways to vote. So those are my 4 jobs.
You gave me so many points that I want to ask you about with your many, many hats that you're wearing. First, let's start with your background. You mentioned that you have a master's in public health, and I believe that you also have obtained a women's health fellowship. Can you talk about your experience in both of those and how you have utilized those extra degrees to help you push forward in advocating and serving women?
So the Women's Health Fellowship that I did was a 2-year fellowship. It was actually through an FKHC in New York City. They got a grant from New York State to sponsor primary care physicians in research and advocacy. And they actually paid for me to get my master's in public health during the fellowship, which was great. And I got to work on a research project with a focus in reproductive health throughout my 2 years. And in addition to that, I got to also train with various family medicine physicians and also like GYNs on how to provide abortion care and also contraception care management, which was very rewarding work. And the last component of that fellowship was also learning how to become an advocate for patients. So I got to go to the New York State Capitol in Albany several times and speak to different legislators to talk about the importance of reproductive health access. And I also went to DC and spoke with our Congress and our senators about the importance of reproductive health care access. So it was a very challenging 2 years, but a very rewarding 2 years, because I felt like my residency experience was great, but the fellowship just added a lot more in terms of my knowledge base, in terms of providing women health, and also the fact that I was able to get that master's in public health. And I focused in health policy, so I had more of an understanding of what the healthcare system, how it works, and how to work my way through it in order to be able to change policies and make more of an impact.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Wow. This brings me to another question. For students who may be on the cusp of deciding between pursuing obstetrics and gynecology to advocate for women's health and going the family medicine route, why did you choose family and then the Women's Health Fellowship? And do you think that it made a difference in the way that you practice now?
I definitely do, because I feel like I get to see the whole entire family, which is amazing. OB doesn't do that. I love to be able to deliver my patients' kids and then see the kids and see them grow. That's one of the most rewarding aspects, especially during residency. I don't personally deliver babies now, but I mean, I get to see my patients' kids along with them during that visit. And that kind of rapport and like you just don't get with OB. So that was one of the things I loved about family medicine. And the second thing, during my OB rotation, I loved it, but I hated being in the OR. I just knew I was just like, I'm not meant to be in the OR. It was just not for me. I did not feel at ease there. And that's not something you necessarily know until you go and you have that exposure. You really don't know how you're going to feel until you're there. And then you're like, oh, I either like it or you don't like it, or you're so-so. But for me, I already knew. I'm like, no, I can't do it. So, yeah.
That makes complete sense. A lot of times, like we say, wait till you get into your clinical years, because you can have a specific game plan for yourself mentally when you enter medical school. Like you said that you wanted to be a pediatrician. And when you get there, you're like, what? I got to deal with these parents? These kids don't talk? What is this? What? But you find your way and you go through each rotation with an open mind and putting your best foot forward, and something can be fun. You can absolutely love a rotation. Like I loved my radiology rotation that I took in medical school, but thinking about it critically, when it was time for me to choose a specialty, I didn't necessarily want to be a radiologist long-term until retirement. So it's great that you mentioned that you're going through with an open mind and you're like, I like that. I don't like that. And moving forward with your choices, and then figuring out how you can choose a specialty to help impact the patient population that you would like to impact. And you seem to have really wanted to advocate for women as well as bring together and treat families.
Yes.
Also, going with you having 4 jobs, that isn't typically very common, I would say. What made you want to diversify your experiences?
Honestly, I had amazing mentors during like residency and fellowship that actually had various jobs, and I didn't even realize there was like an option, because honestly I thought, okay, I'm just going to work in one place and be done. But I saw how they navigated through it, and I was just like, oh, it's actually like a lot of fun. It keeps you on your toes, you're never bored, and I figured, well, if they could do it, why can't I? So don't get me wrong, it's very challenging, it can be very stressful at times. I'm not going to deny that, because it is. But one thing I learned, at least my first year out of fellowship, because I really was like full time at my primary job and working these other jobs. Well, I wasn't working at the health department just yet, but I was working the two other jobs. And I realized I was like, I don't need to work a full 40-hour week here. I've cut down. So I've learned it took me a while to realize that I need to cut back. So I have cut down on my hours there in order to have somewhat of a balance. And the other jobs are not full time. They're, like I said, I'm only at Planned Parenthood 1 or 2 times a month. And then the cluster is, a couple times we meet throughout the year. So they're not really time consuming. I feel like I don't even consider it really work, because those are things that I enjoy. And it's like a way for me to network and advocate about something that I love. So I don't even really see it as work, which is a good thing if you enjoy it that much that you're not really seeing it as work, even though it is,
I totally agree with that. And I thank you for that clarification, because some people may say, wait, I can barely get through this residency program all at once, or these courses. How can she have 4 jobs? But time flies when you're having fun. And you brought up a very important part about you finding things that you enjoy doing where it doesn't seem like work, but also prioritizing yourself in time to do it. So you cut back on your hours at work because you said that you're not working a full 40-hour job. And then you've chosen experiences that are meaningful to you, like working 1 day a week or so at Planned Parenthood, but not overexerting yourself to try to go and work both multiple times a week. So figuring out what you want to do and how you can impact your patient population and community, but also being realistic in your expectations of what one person can do.
Exactly.
That's wonderful. Also thinking about leading into what one person can do for many, as you are working on, you mentioned a little earlier about your advocacy work. So in these current times with this current climate, women's rights are at risk for some changes and being taken away. How do you propose that physicians advocate for their patients?
So we need to vote. I can't stress that enough. We definitely need to vote. And actually talking to our various legislators, they actually like to hear from doctors. They love to hear from doctors. The various times that I've actually talked to congressmen and senators, they're so surprised that we've taken the time to talk to them and give them our perspective, because they don't know anything really about medicine, and they're making these policies, so they value our input. So don't be scared to talk to them. Look up who is serving your county that you're serving, that where you work, and just call the office and say, listen, these are my concerns about whatever, mine are mainly, healthcare equity and reproductive access and everything else. But whatever your concerns may be when you're out practicing, let them know, because the more times they hear it, the more times that they are likely to, do something about it, because they'll see the importance of it. So I can't stress that enough.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
Is there any particular things that you've learned in your fellowship that helped you advocate in a efficient manner?
Well, one thing, the fellowship taught me I can't be scared to speak up. Because before I was like, especially during residency, you don't really know your place, your training, you don't want to necessarily speak up. I was like more reserved, but in fellowship, they were like, no, speak your mind. They need to hear from you. Speak your mind, especially, as a Black woman physician, like, yes, there's starting to be a lot of us, but there's still, there needs to be a lot more of us. And so they need to hear from us because, we definitely do have a different perspective than other physicians because it's just the way that, we see things because we are interpreting things completely different. And it's a fact that they need to hear, especially now. I know there's been a lot of advocacy for Black women and especially in regards to maternal mortality rates, how they've increased. So hearing from us that patients have a lack of trust about the healthcare system and what those concerns actually are makes an impact because yes, they're hearing it from, the population, but when they're hearing it from the physicians as well that are agreeing with it, that makes even more of an impact. So yeah, the fellowship definitely taught me to speak up. I can't just stay quiet. It's not going to really help anyone if I do that.
That's totally true. And I love that you mentioned voting. But at this point in time, when you guys are listening to this, we'll be on the other side of November 3rd. Yeah. So voting
hopefully
is important. Hopefully you did vote. But also that ongoing conversation about getting involved with your legislators and your senators and your local representatives, because you shouldn't always look for a general election every 4 years or every 2 years even. You need to have these ongoing communications. And with that, with becoming a physician, you are a born leader. You're a natural leader, whether or not you have a title or not. Even as a student, you have a voice. That is important. So figuring out how you can utilize that voice will help serve your patients. So if you notice that there are issues with, like Dr. Calixte was mentioning about increased maternal mortality, speaking up, figuring out how to listen more to your patients, figuring out how to change policies locally versus the government, and even in your ecosystem of your hospital or in your ecosystem of your medical student training. These things that you talk about are important, and you're learning so much from different places, and people need to come together to learn together as well as to impact change. Now, I will say that this was a lovely conversation that we had, and we've come to a close. So I just want to ask you.
Oh, that was so fast.
I know, time just flies by, like I said, when you're having fun. But my final question for you is, what is one of the best lessons that you've learned that sticks out to you in terms of your medical training?
I remember there being a guest speaker at my med school. She was an emergency doc physician, and she said she lives by this quote: faith, focus, and follow through. And at first, when I heard it, I was like, what? What does she mean by that? And then, she went into detail. She's like, you need to have faith in yourself. You need to focus on your goals, and you need to follow through on your various tasks. And that's what you need to get through. And I tell you, I had that up on my wall in med school, and I would stare at that, especially during hard times when I was just like wondering why I decided to do this. And I'm like, and that's what kept me through. So I was just like, you know what? I was like, Cynthia, you need to have faith in yourself. Come on. You're going to get through this. This is just a brief period in your time, in your lifetime. You're going to get through it. And then focus on I had set goals, like I need to get this accomplished by this time, make sure I get through this chapter, make sure I answer these amount of questions in order to make sure that I got through whatever particular rotation or course that I was doing at that time. So that was one of the most valuable quotes that really impacted me and helped me get through.
That's awesome. It's always those things you may think are very minor, but if you focus on your goals and you have faith in what you're going to do, like everyone, you guys who are listening to this podcast realize that so many of us have been right where you are, whether or not that's in the pre-medical phase where you're applying to schools or thinking about different routes to enter medical school, or you're right there in the thick of it where you're in the preclinical years trying to study and take all of those examinations ever so often and just learn from that fire hydrant's worth of information. Or if you're in the clinical years and you're trying to learn the moves of how to present cases appropriately and how to give a physical exam and document and things like that. So we've all been there, and we're all on the other side telling you that you can do it too. And you figure out the ways and the things that will motivate you to get through, and you hold on to those. And years later, you may be like Cynthia, still remembering that quote. Or I remember a personal quote for myself that I won't share, but that I used to write down before every test. And it is something every time I read it again, it's just near and dear to me. And it just shows that you can make it to the other side. So we're rooting for you.
It doesn't feel like it, but it does.
It does. And I really appreciate you coming and joining us today. I just want to give you an opportunity to say goodbye. And for everyone else, I'll be here next week with someone else.
Alrighty. Bye, guys. All the best.
Thank you so much.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.